Have you ever experienced a sudden pain on the upper right side of your abdomen after eating a heavy meal? Maybe it felt like indigestion, gas, or something you ate didn't agree with you. But in some cases, that discomfort may actually be caused by gallstones. Gallstones are one of the most common digestive conditions affecting older adults. In fact, millions of Americans have gallstones, and many don't even realize it until symptoms become severe. In today's video, we'll discuss what gallstones are, the warning signs you should never ignore, who is most at risk, foods that may trigger symptoms, foods that may support gallbladder health, prevention tips, and when it's time to see a doctor. Let's get started. What are gallstones? Gallstones are hardened deposits that form inside the gallbladder, a small pear-shaped organ located just beneath the liver. The gallbladder stores bile, a digestive fluid produced by the liver. Bile helps your body break down and absorb fats from food. Normally, bile contains a balanced mixture of cholesterol, bile salts, and other substances. But when this balance is disrupted, small crystals can begin to form. Over time, these crystals may grow into gallstones. Some gallstones are tiny, about the size of a grain of sand. Others can grow much larger. Many people have gallstones without ever experiencing symptoms. These are often called silent gallstones. However, problems occur when a gallstone blocks a bile duct. This can prevent bile from flowing properly and may trigger significant pain and inflammation. Warning signs of gallstones. One of the most common symptoms is sudden pain in the upper right portion of the abdomen. This pain often appears after eating a fatty or heavy meal because the gallbladder contracts to release bile during digestion. The pain may be mild at first, but for some people it becomes intense and difficult to ignore. Gallbladder pain can last anywhere from several minutes to several hours. Some people describe it as a sharp, cramping, or squeezing sensation. The discomfort may spread to the back, between the shoulder blades, or into the right shoulder. Nausea and vomiting are also common symptoms. Many individuals report bloating, excessive gas, burping, or a feeling of fullness after eating only a small amount of food. Indigestion that keeps returning after meals may also be a warning sign. As the condition becomes more serious, symptoms can worsen. A blocked bile duct may lead to fever and chills. Yellowing of the skin or eyes, known as jaundice, can occur when bile is unable to flow properly. Dark-colored urine and pale-colored stools may also develop. If you experience these symptoms, medical attention should be sought promptly. Who is most likely to develop gallstones? Although gallstones can affect anyone, certain people are more likely to develop them. Age is a major risk factor. Gallstones become increasingly common after age 60 because changes in metabolism and bile composition occur naturally as we age. Women are generally more likely to develop gallstones than men. Hormonal factors can influence cholesterol levels in bile, increasing the risk of stone formation. People who are overweight or obese also face a higher risk. Excess body weight can increase the amount of cholesterol released into bile. At the same time, rapid weight loss can also be problematic. Many people are surprised to learn that losing weight too quickly may actually increase the risk of gallstones. Crash diets and extreme calorie restriction can cause the liver to release additional cholesterol into bile. Individuals with diabetes may also have an increased risk. High cholesterol levels and metabolic syndrome are commonly associated with gallstone formation. Family history may play a role as well. If close relatives have experienced gallstones, your risk may be higher. Foods to avoid. If you have gallstones or want to reduce your risk, paying attention to your diet can be very important. Certain foods may trigger gallbladder attacks or make symptoms worse. Fried foods are among the most common triggers. French fries, fried chicken, onion rings, and similar foods contain large amounts of unhealthy fats that force the gallbladder to work harder. Fatty cuts of beef, pork, and lamb may also contribute to symptoms. Processed meats such as bacon, sausage, salami, and hot dogs are often high in saturated fats and preservatives. Fast food meals are another common problem because they frequently combine unhealthy fats, refined carbohydrates, and excessive calories. Many baked goods contain large amounts of butter, shortening, or trans fats. Donuts, pastries, cookies, and cakes should be limited whenever possible. Sugary beverages such as soda, sweet tea, and energy drinks may also contribute to weight gain and metabolic problems that increase gallstone risk. Highly processed snack foods including chips, crackers, and packaged desserts may also be best enjoyed only occasionally. Best foods to eat. Fortunately, many healthy foods may help support gallbladder health and overall digestion. Fresh fruits are an excellent choice. Apples, berries, oranges, and pears provide fiber and antioxidants that support digestive function. Vegetables should also be a major part of your diet. Leafy greens such as spinach, kale, and romaine lettuce provide important nutrients while remaining low in unhealthy fats. Broccoli, carrots, cauliflower, and Brussels sprouts are also excellent options. Whole grains are another smart choice. Oats, brown rice, quinoa, and whole wheat products provide fiber that may help regulate cholesterol levels. Since cholesterol plays a role in many gallstones, maintaining healthy cholesterol levels is important. Beans, lentils, and peas are rich in fiber and plant-based protein. These foods may help you stay satisfied while supporting digestive health. Lean proteins are generally easier on the gallbladder. Skinless chicken, turkey breast, fish, tofu, and legumes are often recommended. Fish such as salmon may provide healthy omega-3 fats that support overall health. Healthy fats can still be part of a balanced diet. Avocados, olive oil, almonds, walnuts, and seeds may be beneficial when consumed in moderation. Drinking enough water is equally important. Proper hydration supports digestion and helps the body function efficiently. Prevention tips. While gallstones cannot always be prevented, there are several healthy habits that may reduce your risk. Maintaining a healthy weight is one of the most important steps. However, avoid trying to lose weight too quickly. Slow and steady weight loss is generally considered safer for gallbladder health. Regular physical activity may also help. You don't have to become a marathon runner. Simple activities such as walking, swimming, cycling, or gardening can make a meaningful difference. Try to stay active most days of the week. Eating regular meals may also help support normal gallbladder function. Skipping meals frequently may increase the risk of gallstone formation in some individuals. Focus on a balanced eating pattern rich in vegetables, fruits, whole grains, and lean proteins. Limiting highly processed foods may also reduce your risk over time. If you have diabetes, high cholesterol, or obesity, working with your healthcare provider to manage these conditions may provide additional protection. Small healthy habits performed consistently often have a greater impact than dramatic changes that are difficult to maintain. When should you see a doctor? Many people dismiss digestive symptoms for months or even years before seeking medical advice. However, certain symptoms should never be ignored. You should contact a healthcare provider if you experience repeated episodes of pain in the upper right abdomen. Pain that consistently appears after meals deserves medical evaluation. You should also seek medical attention if nausea, vomiting, bloating, or indigestion becomes persistent. Emergency medical care may be necessary if pain becomes severe or is accompanied by fever. Jaundice, dark urine, pale stools, or signs of infection should also be evaluated immediately. Early diagnosis may help prevent complications such as gallbladder inflammation, bile duct blockage, or pancreatitis. Modern medical treatments are often very effective, especially when problems are identified early. Gallstones are common, especially as we get older, but understanding the warning signs and making healthier lifestyle choices may help protect your gallbladder and support better digestion. If you found this video helpful, please subscribe to Lean Life for more easy-to-understand health information designed specifically for older adults. Leave a comment below and let us know if you've ever experienced gallstones or digestive symptoms after meals. And remember, taking small steps toward better health today may help you enjoy a healthier and more active tomorrow.